and all. Thank you for joining with us. On behalf of NASH 24 by 7, I welcome you all in today's live Facebook program. Today, we are going to have an interactive session on the occasion of International NASH Day on the topic Emerging Concepts in Fatty Liver, Diagnosis and Beyond. Today, we have with us renowned gastroenterologist Dr. Shubham Vatsya. Sir has done his MBBS, MD in Medicine, DM in Gastroenterology, and is currently a gastroenterologist, hepatologist, diagnostic and therapeutic endoscopist at PSRI Hospital, Delhi. Sir has sessioned and chaired in several conferences and has numerous publications on his name. So on this note, I would like to hand over the session to Dr. Shubham.
Just a small correction. I'm no longer at PSRI. I'm now at Fortis Astronaut Hospital, Srinagar. So today I'm here on the occasion of International NASH Day. I'm going to talk about what is NAFLD or non-alcoholic fatty liver disease, what is NASH, and how it interrupts with our life. So basically what happens is that as we progress our journey of life, particularly in the Asian and the Indian subcontinent, it is seen that there is an accumulation of excess fat or visceral adiposity. This visceral adiposity is responsible for development of insulin resistance, and the development of insulin resistance leads to multiple problems, the core of which is metabolic syndrome. The metabolic syndrome manifestation on the liver is basically fatty liver. Irrespective of the etiology, it is seen that when liver faces an insult, it develops into fatty liver. So the insult can be alcohol, it can be insulin resistance or metabolic syndrome, it can be viral hepatitis, it can be other causes of hepatitis or liver injury. So the first non-specific manifestation is fatty liver. When this fatty liver is due to insulin resistance and metabolic syndrome, then we call it NAFLD. So they say that involvement of more than 5% of hepatocytes with fat adiposity is diagnostic of a non-alcoholic fatty liver disease in the absence of a significant intake of alcohol. So what is significant intake of alcohol? They say that any person, a male who drinks less than 21 drinks in a week and a female drinking less than 14 drinks in a week. So that comes down to an average of around 40 grams of alcohol per day in a male and 20 grams of alcohol per day in a female. So in this setup, an ultrasound is showing fatty liver, and if your LFT, classically the transaminases SGOT and SGPT are normal, then we say patient has non-alcoholic fatty liver disease. This means that this patient does not drink alcohol and still there is accumulation of fat on the liver, and there is no swelling in the form of derangement of the liver function test in the form of ALT and AST. If at this stage the insulting agent here is the fat deposition in your body, which is causing insulin resistance and metabolic syndrome. If there is intervention to that deposition of fat and somehow our body loses fat, then we are going to, this stage is completely reversible because still there is no damage to the liver. But if we do not interrupt this accumulation of fat on the liver and in the body, then with time we see that there is derangement of liver function. We see derangement of AST and ALT. The derangement of AST and ALT is seen as, with fatty liver, comes to a stage of non-alcoholic steatohepatitis or NASH. Now, NASH is per se much more severe and serious than NAFLD or only fatty liver. NASH means that damage and swelling over the liver has started. And if there is no way that we stop this, then the next stage in the spectrum or the continuum of liver disease is significant fibrosis of the liver. And if that is allowed to progress, then we reach a completely irreversible stage, which is known as cirrhosis of the liver. According to the World Health Organization, according to Indian Society of Gastroenterology, according to a lot of other bodies, it is said that NAFLD and NASH are rapidly increasing in prevalence in India. And by 2035, it would be the most common cause of liver transplantation or most common indication of liver transplantation. So this is how NAFLD, NASH lead to significant fibrosis, cirrhosis, and they can lead to liver cancer as well. How can we stop? How can we stop development of NAFLD, or if it has developed, how can we reverse? Right? So the first and foremost and the cornerstone of treatment is always and always fat loss or weight loss or a lifestyle which leads to fat loss. So what is the lifestyle which leads to fat loss? Now you will have to understand that your visceral adiposity, which is the fat accumulated in your stomach, is like an overload of calories which your body did not require. So this is pure mathematics. The amount of calories you eat and the amount of calories you burn or you spend. If what you are gaining in calories and what you are burning in calories is a positive, that means you are in calorie excess, it will accumulate in your body, cause visceral adiposity or abdominal tummy or abdominal fat, which with time will lead to insulin resistance and NAFLD. On the other hand, if the amount of calories you burn exceed the amount of excess calories you take, that means you're staying in calorie deficit, then you're going to lose fat and the chances of developing NAFLD decrease and the chances of reversal of NAFLD increases. Right? So this is very important again to understand that yes, this is how things are moving. So what do you tell the patient? So I tell my patients that you should ideally take a high fiber, high protein and low carbohydrate diet. So the most important thing I think would be to omit carbohydrates. Carbohydrates, particularly with a high glycemic index. That means that the carbohydrates, which when we eat, increase the amount of glucose after eating or increase the postprandial glucose. They are the ones which we need to target the most. What are they? White rice is something we should replace with brown rice, as white rice has a high glycemic index. Right? We should avoid anything which is of wheat flour or maida. And third, which should be absolutely avoided are sweets. These three things should be absolutely avoided. To reduce the amount of carbohydrates and to develop a satiety, the feeling of having food, a very important component would be fiber, right? So having multiple small meals and every meal having predominant fiber and protein content will help us in two ways. Fiber, it helps us have a feeling that we have eaten food, but does not give us many calories. And protein does not cause a lot of insulin spike after eating food. So insulin going up, it converts the carbohydrates into lipids or causes lipogenesis. This would be very important, right? And the importance of reducing the carbohydrates in dinner needs to be mentioned, because a lot of us people, we eat a lot at night and then we sleep, which causes the highest amount of insulin peak and highest amount of fat synthesis and fat generation. If we remain in calorie deficit, have low carbohydrate diet, high in fiber, high in protein diet, then we are doing good on our part to reverse non-alcoholic fatty liver disease or prevent the development of fatty liver disease. third component of this treatment would be your exercise. So they say 45 minutes a day, at least 5 days a week, predominant of isotonic exercise, which is cardiac activity or cardio metabolic exercise like running, like cycling, like trainers. They are extremely important, and they should be adequately mixed with resistance training, which is weight training, right? Regular exercise with calorie deficit is what will actually help us in reversing fatty liver disease, and which will help us in reversing and preventing development of severe fatty liver disease. There are some drugs which are also effective, but they are only effective with adequate lifestyle modification, with multiple small meals of low carbohydrate, high fiber and high protein, along with regular exercise. Then some drugs work. If those drugs are indicated, your gastroenterologist will prescribe you those drugs. And the last thing which I would want to mention here is that NAFLD is very common in patients with long-standing diabetes. So these patients, if not today, are at a higher risk of developing of diabetes, or they already have diabetes. And NASH patients don't only die from liver morbidity, they are at a higher chance of developing cardiovascular mortality in the form of myocardial infarction and heart attacks as well. So loss of weight with the help of diet, exercise, and some drugs, which won't make you lose weight, but reduce the fibrosis and the swelling on the liver, right, will help not only in reducing morbidity and mortality related to the liver, but also related to the heart and the cardiovascular system. So this is what I would like to summarize as a general awareness about non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. And I would thank the Zydus team to give me this opportunity to create awareness of the International NASH Day. And I would like to take any questions there.
Thank you so much, sir, for such a lucid talk. And I have some questions coming from the comment section, so I'll take it up one by one. So, sir, the first question is, how would I know if I have fatty liver or not, if there are no symptoms?
So majority of the early fatty liver disease are picked up incidentally on an ultrasound done for some other reason, or incidental LFT, which is done for some other reason, or as a general body checkup, where you find ALT and ASTs deranged. So that is how you come to know. Either you get a generalized what they call a whole body checkup or sort of thing, or an incidental finding. That is the most common way you'll find out.
Sir, next is fatty liver life-threatening disease?
So per se, non-alcoholic fatty liver disease in the starting is not a life-threatening disease. But as I told you, if you allow it to progress on the spectrum of non-alcoholic fatty liver disease, going to NASH, going to significant fibrosis, going to cirrhosis, then yes, fatty liver disease, or classically non-alcoholic fatty liver disease, can lead to development of significant cirrhosis and hepatocellular carcinoma or liver cancer. And those conditions are definitely life-threatening.
So next question is, are there any Ayurvedic treatment for treating fatty liver?
So scientific evidence says that herbal medicines in the form of Ayurvedic and homeopathic are themselves liver toxic, and they are one of the most common causes of acute liver failure in the country, most common cause of drug-induced liver injury. For any practical purpose, no Ayurvedic or homeopathic medicine should be taken for any liver disease, be it fatty liver or any other liver disease.
So the next question is, does too much drinking of soft drinks can be one of the reasons of fatty liver?
Obviously, because these soft drinks are full of carbohydrates and full of what you call calories. So they will cause a calorie surplus, and the calorie surplus will lead to an insulin spike, and the insulin spike will lead to lipogenesis, and that lipogenesis will lead to visceral adiposity, insulin resistance, and development of fatty liver. Yes.
So next question is, किस तरीके के पेशेंट्स में फैटी लिवर ज्यादा होने के चांसेस होते हैं?
हाँ जी,
फैटी लिवर होने के ज्यादा चांसेस किस तरीके के पेशेंट्स में होते हैं?
डायबिटिक पेशेंट्स में, ओबीज पेशेंट्स में, यही दो तरह के पेशेंट्स हैं सबसे ज्यादा फैटी लिवर डेवलप होने के चांसेस होते
सर नेक्स्ट क्वेश्चन इज, क्या डाइट और लाइफस्टाइल चेंज करने से फैटी लिवर कम हो सकता है या इसकी कोई मेडिसिन भी है?
हैं। आई टोल्ड यू अर्लियर, मैंने पहले भी बताया, डाइट और लाइफस्टाइल चेंज के बिना कोई मेडिसिन हेल्प नहीं कर सकती। कोई मेडिसिन होगी वो आपका गैस्ट्रोएंटरोलॉजिस्ट बताएगा, बट जब तक आप डाइट, ढंग की डाइट और लाइफ एक्सरसाइज नहीं करेंगे तब तक कोई दवाई काम नहीं करेगी।
राइट सर, नेक्स्ट क्वेश्चन इज, आई एम डायबिटिक बट माय एसजीओटी एंड एसजीपीटी इज नॉर्मल, क्या मुझे फैटी लिवर होने के चांसेस हैं?
बिल्कुल, if you are long standing diabetic, more than 8 to 10 years of diabetes, I think you require a fibroscan. A fibroscan will tell you what is your CAP score, which will tell you how much fat you have, and also tell you your KPA score, which will tell you how much fibrosis you have in your liver. And those two things are very important for a long-standing diabetic to know.
राइट सर, नेक्स्ट किसी ने पूछा है कि डू आई नीड टू जॉइन जिम टू लूज वेट?
See, reduction of weight is discipline, and majority of the discipline comes from diet. So even if you are exercising and doing very good gym, आप बहुत अच्छे जिम कर रहे हैं, बट आप कैलोरी डेफिसिट में नहीं रह रहे तो जिम भी काम नहीं करेगा। हर चीज की अपनी इंपॉर्टेंस है, बट सबसे पहले डाइट। एक्सरसाइज आप जिम में कर रहे हैं, आप पार्क में रनिंग कर रहे हैं, आप घर पे कर रहे हैं किसी तरह, वो इंपॉर्टेंट नहीं है। रेगुलर एक्सरसाइज इज इंपॉर्टेंट। जिम इज नॉट व्हाट वी आर प्रेशराइजिंग हियर, राइट? मोर ऑफ कार्डियो। अगर आप हर रोज के 3 से 4 किलोमीटर जॉगिंग कर रहे हैं तो किसी भी जिम से बेटर है। पर अगेन मैं यही बोलना चाहूंगा, कैलोरी डेफिसिट में रहना, डाइट वुड बी अगेन मोर इंपॉर्टेंट देन एक्सरसाइज। एक्सरसाइज इन द एब्सेंस ऑफ डाइट अगेन इज नॉट गोइंग टू हेल्प यू दैट।
सर उसी से फॉलो अप क्वेश्चन ये है कि एक दिन में कितनी कैलोरीज कंज्यूम करना सेफ है?
सेफ 30 किलो कैलोरीज पर केजी बॉडी वेट अगर आप लेंगे तो आपका वेट स्टेबल रहेगा। मतलब अगर मैं 80 किलो का हूं तो मैं 2400 किलो कैलोरी अगर खाऊंगा तो मेरा वेट सेम रहेगा। अगर मुझे 2400 से कम मैं खाऊंगा, सपोज मैं 1800 खाता हूं तो 600 का कैलोरी डेफिसिट हुआ, और मैंने एक्सरसाइज से 200 कैलोरी बर्न करी तो 800 किलो कैलोरी का कैलोरी डेफिसिट हुआ। मेडिकल साइंस कहती है 7700 किलो कैलोरीज के नेगेटिव डेफिसिट पे 1 किलो वेट लूज होता है। तो अगर 800 किलो कैलोरी का नेगेटिव बैलेंस है तो अराउंड 9 to 10 डेज में मेरा 1 केजी वेट कम हो जाए।
राइट सर, विल टेक द लास्ट क्वेश्चन। क्वेश्चन ये है कि सर, आई हैव ग्रेड 3 फैटी लिवर, माय एज इज 45, हाउ डेंजरस इट इज?
Please understand that grading of fatty liver is done on ultrasound, and they are imaging factors. They are reliable, but they are not the most reliable thing. Better than that would be what is your LFT status to know whether ALT AST is deranged, and what is your fibroscan values. Depending on that and your BMI, the treatment would remain the same. If you don't interrupt the progression of fatty liver, then it is going to progress into fatty liver disease. So yes, diet, lifestyle is going to be the cornerstone of your treatment, but whether it is actually only fatty liver or there is significant fibrosis can only be told to you by a fibroscan.
Right. So with this question, sir, we come to an end of question answer session. And thank you so much, sir, for addressing all the possible queries. And for such a wonderful session, I'm sure this session would be very helpful for all the fatty liver patients and their caregivers as well. I would also like to thank all our participants for their active participation. And to stay updated more on liver health, fatty liver, do like and follow our page nash24/7.com. Thank you, everyone. Thank you, sir.